Hi.
Your injury goes back to 5/9/2011, correct?
Yes.
Okay. Now, I'm going to try to summarize what took me at least 3 hours of reviewing a stack of records. And they're online, so it's not like a book where you can arrange it. So I went a little crazy, so I'm going to try to go over it with you and try to hit the high points, or you might consider them the low points. You were a caseworker for Onondaga County at the time of this injury,
Correct.
and this was a karate demonstration?
No, it was a self-defense training course.
Okay.
Mandatory self-defense training.
Okay. And you were karate chopped on the left side of your neck, correct?
That is correct.
Okay. Looks like you were seen in the ER at Community General Hospital, and then you saw Dr. Warren Wolf at SOS.
Correct.
He had physical therapy for a period of time, fitness forum. He had some increased neck pain a little bit later. You also saw Dr. Martin Schaefer. And then you had about a bazillion visits at New York Spine and Bone Center over the years.
Well, they're the only doctors that I've been left to right now. It's just their pain management, so
Okay.
that's,
And then you had a procedure done at Atlantic Spinal Care in Union, New Jersey.
yes,
Okay. He had an endoscopic cervical facet rhizotomy at C4, C5, and C6,
correct.
which did not help.
Did not help.
And then you saw Dr. Seth Seidemann at Rochester Brain and Spine.
Yes,
Sorry, writing my handwriting. And then he looks like he referred you to Johns Hopkins at one point.
yes.
So you saw Dr. I can't read my handwriting, sorry. I can't read it. No excuses. Okay. And they discussed the bilateral thoracic outlet syndrome. Okay. Yeah, you then had surgery sometime in 2014, but I don't have the notes, so I don't know what date it was. It was in 2014. That was the brachial plexus surgery on the left side.
You have to look things up. I can't remember.
You know what? Don't worry about it. I don't need the exact date. Approximately. Was it summer, fall, winter, spring?
So I wrote it down.
This was Dr. Andrew Upwood.
That was 2/4/14. So.
Okay, got it. Thanks. So that was the right brachial plexus surgery.
Correct.
And then you had a lot of treatment at New York Spine and Bone Center again with you had trigger point injections, cervical lipitor injections. You also had Botox injections. Do those injections help, or for how long do they help for if they do?
It would feel, yes, it would help, but I kept telling the doctor that, that you're touching the surface. You need to go deeper. That's what I told her. I said, when you did the trigger point, you were, with the marking, you were getting closer to the pain. But she said that doing Botox into the nerves that are listed as abnormal is too risky because those nerves control breathing, and so
Right.
she said it's you don't want to risk. And,
So,
before the surgery, I went to the doctor, and you mentioned John Hopkins. They referred me to the doctor. There was a doctor in Maryland,
Okay.
and I saw him for 3 weeks. Spent my own money, and to rule out something called myofascial pain syndrome. So they did something called dry needling. I went down there, stayed in a hotel, and
When was that?
before the surgery.
Before the 2014 surgery?
Yeah, so I mean, it was 2013. Probably fall.
Yeah.
And I went 3 weeks down there. It cost, I spent, a lot of money, but, my parents were, trying to help me, and, they wanted to rule out myofascial pain syndrome, and the doctor, what was his name?
No, don't worry about it.
Janet Travell, does that ring a bell? No. He worked with Janet Travell.
Okay.
What was his name? He was a specialist, he was a neurologist, he's very good, and I can't, Gerwin, Dr.
Okay.
Robert Gerwin. So I saw him for 3 weeks, and he said, your muscles are so tight, they're so spastic. He said, the numbness and the tingling in your fingers, the fact that after 3 weeks, we're not making progress, and that no matter how deep my physical therapists go, they are saying that they just say it feels like adhesions. They said spasms. Anyway, I guess the point is, after him, he referred me to a brachial plexus surgeon. He recommended surgery.
Right.
He was a neurosurgeon, though, and his name was Dr. Dellin.
Okay.
And he's down there, Dellin. I think.
Now, who's the one who did the surgery?
Well, Dr. Dellin was too expensive.
Okay.
I saw another doctor who was cheaper. Well, he was, but
Okay.
he wasn't a neurosurgeon. He was a general surgeon, good surgeon, I guess. He does plastic surgery, so I understand it's the same area.
Right.
But, he said, based on the neurography scans, I think you're at a point where you've tried everything. So, let's try the surgical option and see what happens. Tried the left side. I'm no worse, but I'm no better. And I know he said there was lots of scar tissue. He said that.
Now, you've been getting the Botox injections. Have those helped at all?
As I said, it helps.
Well, no, but do you feel that it helped?
It helps. It's the same kind of help that when you take, I would say it would be equivalent to taking PEC when I was getting Oxycontin. At the time when I was taking the Oxycontin, it gave me some peace for a couple of hours where I could close my eyes and get some sleep. The pain and the hands.
Okay.
But it was nothing. The benefit to me was very, at best, for maybe I would, like a week or two, I would feel better. And then that was it. And so I kept telling the doctor, I said, can you go deeper? And they kept saying no.
Right.
And the same thing with the dry needling. They said, you can't go any, I kept hearing the physical therapist called Dr. Gerwin, and he would come in and he said, I've seen this before. He said, this is not myofascial pain syndrome. He goes, I've worked with Janet Travell, I am the expert. There's no one else that knows more about myofascial pain syndrome than me. He referred me to Dr. Dellon, and Dr. Dellon was who I wanted. Well, I thought a peripheral nerve surgeon who is a neurosurgeon would be the best surgeon, but they charge more, significantly more. So I couldn't, as it was, I already spent a lot of money, everything I have, and
So at this point now.
sorry, I'll let you go for it.
What bothers you the most?
Constant. It never stops.
Is it both sides?
It's both sides. It's worse on the right than the left. But it just feels like somebody is stretching, like they're stretching me.
So is it numbness or tingling or pain?
Both hands, I told since the first day, I get the numbness and tingling in my hands. I told them it's the
So
thumb
what-
and it's the pinky. And that's, I've,
What things are you able, what do you do most of the day now?
typically I try and sleep whenever I can sleep. From exhaustion usually. Since the reduction in pain meds, it's been significantly worse. But I have no choice. They took the pain medication Oxycontin away gradually and replaced it with methadone. And unfortunately, the methadone does not alleviate the pain as well as the Oxycontin. So my eyes hurt sometimes from just keeping them open. I close my eyes, I try to get some sleep. I tried everything, and it's just very difficult when the pain it never stops. I never, I've been through a lot, but I just wish the pain could be reduced or significantly reduced, and other than the one procedure on the neck that the doctor did that I told you about, you read the
Right.
and I said to him, what does this mean? And he just said, well, I would refer you to, the next thing I would refer you to would be, he said, a brachial plexus peripheral nerve surgeon. And that's above his pay grade of a plastic surgeon. Like he said, that's, people that don't have success here. He was a physician. And that's why I did see Dr. Dellon, but I had an appointment to see a doctor in New York City. His name was Dr. Columbia. Are you familiar with Columbia?
Well, vaguely, but there's hundreds of doctors. I probably wouldn't know the individual one.
name, he's the only one that takes workers' comp. He's a neurosurgeon at Columbia who is a peripheral neurosurgeon. I have his emails, the confirmation of the appointment.
Did you have an appointment with
I
him?
had an appointment. It
Okay.
was canceled 2 weeks prior to my appointment.
Okay. So is that going to be rescheduled, or?
No. Winfrey, Dr. Winfrey,
Okay.
Winfree maybe. If you look at Columbia, it's Dr. Winfrey.
Okay.
I had an appointment, it was 2015, it was late fall of 2015.
Okay.
I was all ready to go down there. I'd never been to New York City, but I was gonna take a train down there and, see this guy. And then I got an email saying, we regret to inform you, Dr. Winfrey no longer participates with New York State Workers' Comp.
Okay.
At this time, he recommends you see a muscle specialist for,
Okay.
and I emailed back that I saw Dr. Robert Gerwin, who is, worked with Janet Travell, and then I got an email back saying, there's nothing we can do for you. And they had no one else they could refer me to. So now I am still looking for a peripheral nerve surgeon as a consultation,
Okay.
and I have not found anyone, unfortunately. So,
When's the last time you worked?
5/16/2011.
Okay. So you just worked a few days after? Okay.
I was, when I got hit, I thought, Jesus, I wrongly assumed it would get better. It hurt,
Okay.
but I just thought,
All right.
unfortunately,
So how long had you been working at that job?
oh God, 6 to 8 months roughly.
6 to 8 months?
Yes, it started there.
Okay.
And it's ironic that, I was at a self-defense class,
Okay.
and, I'm sorry, but
All right. Prior surgery, you had surgery on your low back in 2003, right?
correct,
You've had colon surgery, small bowel surgery, and both
correct,
hernia.
yes,
Okay. And you've had kidney stones before too?
yes.
All right.
And I thought that was the worst things could get. I really thought that a kidney stone, getting stuck in the ureter, I thought that was,
Okay.
I mean, as excruciating as that was, when it passed, I went to bed. It was like I went, I stopped screaming and the pain was gone. Same thing with my back. The day after my back surgery, the pain was gone. I woke up in the hospital bed. Dr. Zeidman was there. I said, the pain's gone. It's gone. My neck is not
Right.
stopped hurting. And Dr. Zeidman was the one who said, I'm a neurosurgeon, but I'm not a peripheral nerve surgeon, so he recommended in 2013 that I see a peripheral nerve surgeon, and I'm still the only one I saw, I paid for, and as I said, at this point, I can't find one in New York State that takes comp anymore. The last one, Dr. Winfrey, was
Right.
it, so,
Okay, so you're allergic to Cymbalta, Dilaudid, Neurontin, and Nucynta?
correct.
And let's see, you've got, take medication for your thyroid. Do you have asthma?
Yes, but
Okay.
it's
And
allergy asthma.
Okay.
It's I haven't, it's sporadic. it's frustrating because usually by the time I use the inhaler, it's expired.
Okay.
But, yeah, it's,
All right, and I got a list of your medications, because it's kind of a long list. I just got it.
Yeah, I got
It's a
it.
pretty recent one.
I got it here too.
It's probably, did you imagine, yeah, can I take a look at yours?
Sure.
It's probably the same as mine.
That's
the most current one?
yes.
Well, can I have a copy of that? That way I'll have the right list.
Can I just, this- I don't know.
Well, okay, don't worry about it.
Do you mind if I just cut it out, so?
Well, don't worry about it. I've got.
I mean, I
it's
can
all-
read it off to you, if you want me to go read it
No,
off.
it's not okay.
But the methadone is what's been
Right, you're
replaced.
taking 10 milligrams methadone?
Yes, 4 times a day, but it's,
4 times a day?
yes, 4 times a day. But it's not as effective, but, you know, there's nothing else that I know of that I could try. The only other thing would be medical marijuana, which is something that I don't know if it has any medicinal properties or if it's just a bunch of marketing. I don't know.
Are you married, single, divorced, separated, whatever?
Single,
And you have any kids?
no kids,
Okay, and you don't smoke?
never smoked.
And you probably don't drink?
I haven't drank since 2011,
Okay.
since right after the accident.
And how tall are you?
5'7",
And the current weight?
240 pounds,
All right. And you're right-handed?
correct.
Okay. All right. Do the fun stuff. Okay. Just check your position there. Okay, you want to squeeze this as hard as you can. All right. 16, and this side. 16. Which side bothers you more? You said your right bothers you more.
Right's bothers me more.
Yeah, slightly better, but not a big difference.
Just, it's always like a frostbite.
All right, just see your heels here for a minute. Now, when I touch you here, can you feel me okay?
Yes,
Does it feel, I mean, you can feel me okay,
yes.
but it feels odd, but you can feel me touch you.
I can feel you touching.
Okay.
It just feels like, it's like if you're sitting in the toilet for a long time and, you know, you get the,
Yep, I know what you mean.
it's a slight tingling, and just numb. And it just doesn't,
Okay.
but
Does this bother you? Either side?
yes, there.
Both sides?
Yes, both sides. Right there is that's exactly where I was gonna say.
Okay. not too bad in back here.
It's not the center anymore, it's both sides.
Both
There,
sides.
there you go, right there, and into the shoulders.
All right, look straight ahead. Get this on. Good. All right, look down and look up. Like, okay. Bend to the right. No, I meant look. Tilt your head.
I'm sorry.
Oh, it's all right. You can swivel. That's part of it too. Swivel both ways. Yeah. You don't go very much either way. You know. Okay.
Put the
And then over
pillow,
this way.
the pillow is for support
Okay.
is what I've used because I used to sleep on my back and now I can't sleep on my back anymore.
Do you drive at all?
I haven't driven since 2012. I don't. I didn't feel comfortable with the steering wheel and dropping things, shaving, just the soap. I mean, personal grooming is just, everything is more difficult and even just things that I used to just,
All right. When I do that, does that bother you?
yeah,
Where? More in here? Like
yes,
that? Okay.
here,
Okay. Same thing on this side. How about bring it up?
yes, here though,
Okay.
right there. Right there, doctor.
Okay.
And then it just goes into the shoulders and it feels like somebody is stretching me and pulling me tighter and tighter. And it just doesn't stop. The muscle relaxants help, but it's just an ongoing battle of fighting. Take the muscle relaxants and they help with the pain, but then they cause other problems and, you know, I just, there's no way to live like this. I unfortunately am at the mercy of trying to find a doctor who will at least see me, who could probably, as I said, it's been years and I'm still waiting for a peripheral possible neurosurgeon consultation.
All right. You are all set with me.